Good afternoon. I'm Jerry Cruz. I'm the Dean and Provost of the Southern Illinois University School of Medicine. Governor Pritzker, directors, legislators, partners, and guests, on behalf of the faculty, staff, and learners of the SIU School of Medicine, I welcome you all to the Memorial Learning Center for this historic announcement. The SIU School of Medicine was founded in 1970, and over the past 52 years, we have trained more than 5,800 physicians through our medical school and through our residency and fellowship programs. Today, 339 of our physician graduates have become psychiatrists, the majority of which serve citizens of the state of Illinois. In collaboration with our hospital and community partners, the School of Medicine employs many behavioral health professionals. This group includes psychiatrists, psychologists, social workers, counselors, and in a new state program, peer support specialists and others. These professionals work to improve the behavioral and mental health services for everyone in the state of Illinois, including those in the most remote, most underserved, and most impoverished areas of the state. Prior to the pandemic, there already existed a severe shortage of such behavioral health professionals in Illinois and across the United States. Now, 3 years after the start of the pandemic, and mainly because of dramatic increases in demand, that shortage has worsened significantly. Our mission at the School of Medicine is to optimize the health of the people of Central and Southern Illinois, and that mission meets the mandate of the moment. That mission is aligned with the state's commitment to transform behavioral health services in Illinois. The School of Medicine applauds both the expertise and the dedication of the Pritzker administration in the area of behavioral and mental health. We certainly support the administration's development of new programs and innovative digital means to improve both access to mental health services and the delivery of those services. We are honored to be a part of that vision. And I thank Governor Pritzker and his administration for their leadership and for this new partnership to address the state's behavioral health workforce needs, and for giving SIU the opportunity to work with new partners like the University of Illinois Chicago to improve that workforce across the entire state. It's now my great honor to introduce Governor Pritzker.
Thank you, Jim. Well, thank you very much, Dr. Cruz. It is a good day. It really is a good day, and it's so nice to see all of you here today. I want to thank the SIU School of Medicine's Memorial Learning Center for welcoming all of us, because it does feel like coming home to people who really care about people who are in need and people sometimes who are in crisis. And you all do tremendous work here, so thank you for all of that. And I'm delighted to be here alongside state leaders. You see a lot of them behind me, community partners, local legislators, the mayor, and SIU and UIC faculty and students to celebrate the launch of a brand new behavioral health workforce education center to expand our workforce and further support our state's behavioral health transformation. I laid out one of those areas of transformation nearly 2 weeks ago with the release of the Blueprint for Transformation of Mental Health Services for Illinois Youth, an interagency effort to create state-of-the-art evidence-based treatment and services for young people with behavioral and mental health challenges. From care portals and universal screenings to improved coordination of service delivery and increased statewide capacity, we are laying out a plan to build the best behavioral health system in America. Built in Illinois, we will lead. We will lead the nation when we're all done with this. But in order to make all of that happen, we need a quality, robust workforce to meet the demands of the time, especially in light of our nationwide critical worker shortage. So we're launching this Behavioral Health Workforce Education Center, a partnership between the Illinois Board of Higher Education, Southern Illinois University's School of Medicine, and of course, University of Illinois Chicago's Jane Addams College of Social Work. It will begin with a $5 million annual investment from the Department of Human Services to help both rural and urban areas of our state address the behavioral health crisis to increase access to effective services for all Illinoisans. This is the workforce component, and it's hugely important. Nothing else happens without building up our workforce in this area. Through recruitment and training, data collection on behavioral health needs, increased diversity in the workforce, and expanded capacity of healthcare providers, we are attacking the workforce shortage head-on and changing the status quo. From paraprofessionals to social workers, counselors to psychologists and psychiatrists, this center will cover the broad spectrum of behavioral health professions. And we want even more public and independent universities and community colleges to join us in this game-changing effort. Together, we want to become a national leader in behavioral workforce development and a pioneer for behavioral health care in general, because it is what the people of Illinois deserve. To Senator Laura Fine, Senator Mary Edley Allen, Representative Maurice West, Representative Lindsay LaPointe, and Representative Paul Jacobs, thank you for your steadfast advocacy in the state capitol for a more robust behavioral health care system. Today is a testament to your labor, and I couldn't be prouder to stand alongside all of you. Without SIU's Dr. Jerry Cruz and Dr. Carrie Wolf, as well as our partners at UIC, this groundbreaking education center would not be possible. On behalf of the state of Illinois, thank you for your vision and for your commitment to the well-being of Illinoisans everywhere. And with that, it's my great pleasure to turn it over to truly one of the spectacular leaders in human services in the entire nation, and that's our Department of Human Services Secretary, Grace Ho.
Thank you, Governor. Good afternoon.
Good afternoon.
Thank you, Governor, for your leadership and your relentless advocacy. You've been a tireless supporter and pursuer of ensuring that Illinois has a strong behavioral health system. It's an honor to be here with all of the leaders behind me, including Lieutenant Governor Stratton. And it's an honor to join all of you as we announce the Behavioral Health Workforce Center. We are here today because we know that there are many of us, many of our loved ones, that struggle with behavioral health challenges, and their struggle is further exacerbated by the challenging search for help. We know from our own stories, and we know from the data, that Illinois needs to add significant numbers of mental health and substance use prevention and treatment workers to keep pace with the demand for services across a range of behavioral health and wellness concerns. In fact, by 2030, without intervention, we are projected to have a shortfall of more than 3,300 behavioral health providers. We know that we're not alone. There's a national shortage in the behavioral health workforce, and at the same time, more and more of us are seeking services. And while we are not alone in our workforce challenges, as the governor stated, we are taking leaps and bounds ahead and taking extraordinary steps to mitigate and combat them. We have instituted dramatic funding increases to community-based mental health and substance use prevention and treatment providers. We have provided nearly $30 million in financial support to help mental health providers, allowing them to recruit and retain staff and adapt their operations to a COVID-19 environment. We have funded the Community Behavioral Health Care Professional Loan Repayment Program, incentivizing behavioral health professionals to work in high-need areas. And we've launched a comprehensive program to support the certification of people with lived expertise who have themselves found a path to recovery and want to be assistance to others to find their own paths. In the first 3 years of the program, we will add 500 new certified recovery support professionals to the workforce. We recognize that the behavioral health workforce must have the right training and skills. Our providers must operate from a trauma-informed perspective and do so with compassion. Our behavioral health providers must be proficient in the most effective and efficient tools like telehealth services, and we must have a behavioral health workforce that looks like we do. That means that individuals in our workforce must not only mirror the communities that they serve, but also understand the cultural, geographic, linguistic, and economic nuances of effective care. The Mental Health Omnibus Bill, with Governor Pritzker's support, breathed life into the task force that the General Assembly authorized us to kick off in 2018 as a part of the Behavioral Health Workforce Education Center. And now we are here to celebrate the creation of the Behavioral Health Workforce Center. Under the leadership of Dr. Wolf at SIU and Dr. Leathers at UIC, this center brings together a dedicated team from state agencies, academic partners, experts, and community members to build and grow the workforce that Illinois deserves. I want to also recognize our team at DHS, Dr. David Albert, the Director for the Division of Mental Health, as well as Director Garcia from the Division of Substance Use Prevention and Recovery for their leadership. And it is my great pleasure to turn it over to our partner, Dr. Kari Wolf, with the Southern Illinois University School of Medicine. Sorry, Dr. Wolf. Thank you.
Good afternoon. Thank you, Governor Pritzker, and our state partners for being here today to announce this new Behavioral Health Workforce Center. In 2021, I was in this very room with the governor and leaders of the Black Caucus. In a major effort to expand health equity across Illinois, Governor J.B. Pritzker signed the Healthcare and Human Services Reform Act into law. That legislation represents the Illinois Legislative Black Caucus's healthcare pillar and established the Behavioral Health Workforce Center. I am so proud to be standing here today for this formal announcement, and I'm thankful for the leadership of every leader and advocate that brought us to this moment. As the chair of the Department of Psychiatry and at the SIU School of Medicine and the leader for the center at the School of Medicine, I'm honored to lead this initiative and look forward to working with our partners here today. I am also ready to work closely with educators, providers, learners, advocates, and regional partners around the state to address the behavioral health workforce needs for the future. I would like to acknowledge the time and commitment of the legislative task force members convened in 2018 to address the behavioral health workforce shortage. The work of those task force members and their teams laid the foundation for this new center, and their recommendations will help guide the future accomplishments of this center. I want to thank Governor Pritzker, Secretary Ho, Secretary Ostro, and my UIC colleagues for the collaborative spirit in which this center has been established and for their continued commitment to the work we must all accomplish together. It will certainly take all of us pulling in the same direction to build the necessary workforce that we need for the future of this state. We have been facing a workforce crisis in mental health for years due to a shortage of behavioral health specialists. Local staffing levels were already critically low in both rural and small urban communities, and the pandemic made matters worse globally with a 25% increase in the number of people seeking mental health care. Through the center, we aim to assess current educational pathways and create additional training opportunities to develop a diverse behavioral health workforce that is distributed across the entire state. We are committed to a mental health workforce transformation in Illinois. We are proud to work with Governor Pritzker, state agencies, and behavioral health leaders all across the state to begin this work. 5 years ago, I traversed the Capitol with the individual who helped craft the original legislation that formed the task force, advocating for passage of that legislation. I now have the privilege to introduce the person who laid the groundwork all those years ago for this behavioral health workforce. Mr. Marvin Lindsay is a longtime community behavioral health advocate and adjunct lecturer for the UIC Jane Addams College of Social Work.
Good afternoon. I'd be remiss if I didn't mention International Women's Day, considering that it's 80% of staff in community behavioral health care centers that are women. Thank you, Carmi. Having worked in community mental health for over 40 years and as the former CEO of the Community Behavioral Healthcare Association of Illinois, I am so pleased to see the Behavioral Health Workforce Center come to fruition. When the Legislative Task Force completed its work in 2019, we highlighted the significant negative impacts of the behavioral health workforce shortage in our state, establishing the dire need for this center. Mental health agencies are struggling to fill positions and provide desperately needed services. Many have been forced to close their wait lists, so people in need of treatment have fewer options for community-based services. As a result, too many Illinoisans with mental illness or substance use disorders end up in expensive hospital emergency rooms and jails, where they do not receive adequate care, if any. These issues have only been made worse by the many challenges of the pandemic. There is no better time to initiate this center to build the capacity of our behavioral health workforce to meet these needs. We at the University of Illinois, Chicago look forward to collaborating with the SIU and our many other essential partners as we build a qualified, modern, and diverse behavioral health workforce across the state. With this center, we will make a real difference by improving both access to care and the quality of mental health services in Illinois. Thank you to Governor Pritzker and state legislators for supporting and prioritizing the mental health of citizens of the state of Illinois. And now I have the honor and privilege to introduce our Lieutenant Governor, Juliana Stratton.
Good afternoon, everyone. I am Lieutenant Governor Juliana Stratton, and I use she, her pronouns. Thank you, Marvin Lindsay, for that warm introduction and for your leadership to expand access to community behavioral health care. And I would be remiss if I did not say to you and all of the social workers joining us today and across Illinois, happy National Social Work Month. We know that social work breaks barriers to wellness, and we are grateful for all that you contribute to our state. And as always, thank you, Governor Pritzker, for your commitment to ensuring Illinoisans have pathways to work well, live well, and be well. I also want to acknowledge the dedicated lawmakers here with us today who provide incredible leadership so that the people of our state have access to the resources and services they need to thrive. To Dr. Cruz and everyone at the SIU School of Medicine and UIC, we appreciate your focus on standing in the gap and building up the next generation of behavioral health professionals. I am thrilled to join you all for the launch of the Behavioral Health Workforce Education Center. I often say that our only way forward is together, and the collaborations and partnerships that helped make this center possible are a testament to just how true that is. By joining forces, we are transforming the landscape of behavioral health care in Illinois. And this work will not only address the impact worker shortage in this profession has had on our state, but also open doors of opportunity for people of diverse perspectives and experiences to enter the field. They will have the tools to make a meaningful difference in their communities by providing support and helping others heal. And people who seek behavioral health services in our state deserve to have a support system that understands who they are and where they come from as BIPOC communities in rural and urban regions. This launch is about uplifting our workforce and making strides for truly equitable, culturally competent care so all of Illinois can thrive. There's certainly more work to do, and I look forward to seeing what's in store as the teams at the Behavioral Health Workforce Education Center continue to dig in. Thank you, and with that, I'll pass it over to a dynamic and dedicated advocate for behavioral health in our state, Senator Laura Fine.
Good afternoon, everybody. I am Laura Fine, the state senator from the 9th District. I am so proud to be from Illinois. Illinois cares. And when it comes to mental health, it's been decades since people who are suffering feel like somebody actually cares. And today we are sending the strong message that if you live in our state, we care about you. As the chairperson of the Mental Health Committee in the Illinois Senate, we are working to ensure that every person in our state who requires mental health care can find it in an easy and accessible way. As we all know, a mental health crisis can't wait. If you have a heart attack, you will have immediate resources for treatment. This is our goal for mental health. The announcement of today's partnership will bring that goal to reality. It will help bring the capacity of quality mental health workers to meet the needs of our friends, our family members, and our neighbors. I am so excited that this center will support people pursuing this wonderful and fulfilling career and connect them to incredible career opportunities. I also look forward to working with my colleagues in the General Assembly and the Governor's Office to enact more legislation to encourage the expansion of the mental health workforce and improve healthcare outcomes for people across the state of Illinois. And with that, I want to introduce my partner and an incredible advocate from the Illinois House, Representative Lindsay LaPointe.
Thank you, Senator, and good afternoon, everybody. I'm State Representative Lindsay LaPointe of the 19th House District, which is the far northwest side of the city of Chicago. I'm so proud to be the chair of the Mental Health and Addiction Committee in the Illinois House. I'm also very proud to be a graduate of the Jane Addams College of Social Work. I'm also very proud to be a former human service professional. And when I did that work of on-the-ground human services, after I got a bachelor's degree, I made $9.40 an hour working at a group home for kids with special needs. A little bit later on, I made $11 an hour as a one-on-one aide to a boy with autism. And then after I got my master's in social work, which took 3 years when I was working with the homeless and going to school part-time, I got a part-time job doing homeless outreach, making $15 an hour, and that was in 2012, so it wasn't that long ago. I truly believe, and I carry it in my heart every day, that addressing our raging problem of the behavioral health care workforce shortage in Illinois is one of the top issues facing us all as policymakers and as residents of Illinois. We are at a time right now where there are needs more than we have ever had them in terms of the needs for mental health supports. We are also at a time where there's a willingness to seek treatment and support more than there ever has been. And so much of that is due to the great work that we've all done in communities and even in the General Assembly to reduce stigma. So we have to keep moving forward on this, building up our behavioral health care workforce. We've heard about it already. It's going to be the work of this partnership. It means recruitment, relentless recruitment. It means retention. It means diversity. It means exposing young people to the amazing spectrum of careers under the big umbrella of behavioral health care. It also means looking really hard at racially biased licensing exams, which we are finally starting to do because they often serve as gatekeepers of these desperately needed professional positions. So I will leave you with this. So many of us believe that healthcare is a human right. I know I do. And at the end of the day, mental health care is healthcare. And if we don't have the humans in the jobs to deliver the desperately needed services, we're not going to be able to deliver on that human right of healthcare and mental health care. So thank you for being a part of this, and I'm so looking forward to the partnership between state government and SIU. And with that, I'm so thrilled to see if anyone has questions and turn it back over to the governor.
Thank you, Representative LaPointe. Before I take any questions, I'd like to take a moment to talk about my administration's announcement this morning regarding the state-operated developmental centers in Illinois. Under previous administrations, state-operated facilities like the Choate Mental Health and Developmental Center and our community care system were drastically underfunded and neglected. And Illinoisans with intellectual and developmental disabilities were left to suffer. Over the past 4 years, I've been hard at work with partners in the General Assembly to implement reforms and to provide the funding necessary for transformation. We've taken action to protect resident safety at our state centers. Over the last 4 years, and together with my budget proposal this year, we will have nearly doubled funding for the home and community-based system of care for people with disabilities and mental health struggles. Earlier today, I announced our plan to build on that progress. It starts with carefully repurposing Choate beginning now and over the next 3 years, while partnering with families to find new, high-quality placements in community settings or other state facilities for residents with intellectual and developmental disabilities. While that transition takes place, DHS is already investing in campus infrastructure improvements and immediately implementing new safety enhancements at Choate and across all state-operated developmental centers, including hiring a new chief resident safety officer, improving our incident tracking system, and hiring 10 additional staff in the independent IDHS Inspector General's office. And finally, we're going to continue expanding support in all of our state-operated centers for residents and their families so they can pursue opportunities for community-based living. Individuals with mental health struggles and intellectual and developmental disabilities deserve respect. They deserve dignity and the highest quality of care to assist them in living healthy, fulfilling lives. And this transformation initiative, spearheaded by IDHS, will standardize and improve conditions across the system to ensure vulnerable Illinoisans receive care in the best possible setting for them. I'm very grateful to Secretary Ho for her leadership on this transformation, as well as to Dr. Kari Wolf and the SIU School of Medicine, who will be critical partners in this effort.
A lot of it, I think, stems from our younger generations. When I first came to the Senate 4 years ago, I asked the Senate president at the time to start a mental and behavioral health committee and kind of got the, and then COVID hit. And I got a phone call that said, hey, you talked about a Senate mental and behavioral health committee, why don't we start one? And so by partnering with the House and Representative LaPointe, we've really been able to bring mental health to the forefront by working with our community organizations that have been screaming from the rafters for years about focusing on mental health. We are finally at the point right now where it has become front and center. And part of this, as was mentioned earlier, is people are not afraid to talk about mental health care needs anymore. They realize that mental health is the same as physical health. And as long as we keep this out in the forefront, we're going to be able to tackle this problem and make sure that people get the care they need.
Representative, you want to add anything?
We all deeply appreciate that question. And what I'll add is we cannot understate the work that has been done to reduce stigma. And we've mentioned it's Social Work Month, it's International Women's Day. There's a reason that we have days of recognition like that, because it is all work that we do that reduces stigma. People have long struggled with mental health issues. They've been exacerbated during the pandemic, but it's really the work to reduce stigma that has allowed the real work to move forward and the recognition on big stages like in the governor's office. And having a House and Senate mental health committee, which it blows me away that we didn't have that until somewhat recently.